Now, about the SPACE program, there are two key components that you talk about. Will you tell everybody what those two components are?
Yes. The two key components of space, and they're both changes in the parent, like I said before, right? Like none of this is like, here's how you're going to change your kid. But the two key components are support and accommodation. What we want to do in space is essentially to increase the level of parental support and to decrease the level of parental accommodation. But both of those words could probably use some explaining or
Yes.
some defining. Support in particular is tricky because it's a word that like a lot of people could hear in a lot of different ways. And many parents might think, well, I am supportive of my child, and in based on a dictionary, maybe you are, but in space we have a very specific definition of what is meant by support. And it really comes down to a simple recipe. It's like cooking a really simple recipe, right? Like you want to make mac and cheese, you need two things, but you can't do it without both. And the mac and cheese of support are acceptance and confidence, meaning you are being supportive for your child who is currently experiencing some distress, maybe that's fear, anxiety, worry, etc. When you're communicating to them these two messages, acceptance, meaning I get it, right? Like it's real. You genuinely are anxious. I'm not dismissing it. I'm not denying it. I'm not trivializing it or delegitimizing it or whatever. I'm just accepting. I'm validating that, yeah, you are in fact feeling this way. And the other ingredient in the support recipe is confidence, meaning I'm also communicating to you that I actually believe that you can handle feeling anxious. I'm not saying you're not anxious, but I believe that you can actually cope with that, meaning you can get through it, right? It's not confidence that you're suddenly going to step up and do the thing you've been scared of or face all your fears. It's just my belief that you are intrinsically able to be anxious right now and still get through it and still be okay in the end. You put both things together, that's when you're being supportive. So maybe it sounds like saying to your child, I get it, this is really scary for you, and I'm sure you can handle it. I'm sure you can get through it. You're going to be okay.
I love this because A, I find it to be honest. I think B, it feels very good to be validated and to be seen. And then also I think for a child to feel that support, that's going to help them get through it to the other end. So as an example, I see a lot of kids in my office who are fearful of their vaccinations. And a lot of parents, and I'm not saying this is the wrong thing to do, but as an example, they'll say, it's not going to hurt that much. It's not going to hurt. You've done it before. And so there's a little bit of dismissiveness there, or a little bit of honestly not being honest, because it will hurt. So I like this statement because you're acknowledging that you see their fears. I see, for example, in this situation, you might say, I understand that you're nervous. I see that you're fearful, but I know you can do it, as opposed to saying it's not going to hurt, which isn't really being honest. But when you say, I know you can do it, that is honest. And kids understand that.
I'm with you. Not to say I've never said it's not going to hurt to my
Same. When I read your book, I thought I've seen the error in my ways, and these statements are so helpful for me. I'm noting it, and hopefully will use it and practice it in my own life. So
yeah,
yes.
because I think the other trap in the it's not going to hurt model, whether that's a vaccination or whether it's any other uncomfortable experience that you're going through, the other trap in that, even in addition to is it honest enough, is that implicit in that is the idea that if it were to hurt, you would not be able to handle it. That if it is going to be uncomfortable, well, then you must avoid it. Well, then you're probably not able to cope with that, because otherwise why am I being so fixated on the idea that it's fine, right? And you can take that to any number of situations. I'm scared to get up in the dance recital and perform in front of an audience. Well, if all I'm being told is no, it won't bother you. Like nobody's gonna care. It's gonna be fine. You're not gonna be uncomfortable. Well, you might think, okay, now I'm gonna feel better. But actually, what I'm hearing you say is that's the only way that I can cope. And I think probably the most helpful thing for an anxious child to learn is actually that it is okay to be anxious, right? Like that you can be anxious, that it's fine. Like not to say that it's not uncomfortable,
But they can handle it.
You can handle it. You can get through it. And that is, I think, a much more important message than, oh, let's see why it is not going to be uncomfortable. Because let's face it, if your child is vulnerable to anxiety, if they tend or they have some predisposition toward elevated anxiety, well, they are probably going to experience a lot of anxiety in their lives. And probably the best thing for them to know is that that's okay, right? Like that they can, in fact, handle that. And that's why that supportive message is so important, right? Because we want them to be hearing, yes, I do get it. Like you said, it does feel good to be validated. You know, sometimes we're in such a rush to reassure and to comfort that we actually skip over the validation, where we end up even like undermining it, right? Like
it's no big deal.
It's no big deal.
No big deal. You got this. You've done worse before.
Exactly. Or sometimes, you know, we lose our temper a little bit. We get frustrated and we start to go in the direction of like, come on, right? Like, come on, you're a big boy. Don't be a baby. Like, suck it up already, right? Which is also, of course, not very validating. And so starting with that validating message of I do get it, it like opens your kid's ear to hear the second part of your message, which is the confidence. Because if your child thinks you don't even really understand that it is hard, why would they even care what you have to say about it? You obviously don't know what you're talking about, right? Like you obviously don't understand it. And so probably your opinion on the topic is not very relevant. But if you can show them that you do get it, you totally understand that it's hard, and you believe they can handle it, well, now you're starting to hold up a mirror to your child that shows them like that reflection of themselves as a child who isn't all that weak and helpless and vulnerable, but is actually like okay, that they're strong, that they're competent, they can handle things. And so we put a lot of work into really just training parents on using these supportive statements. And it doesn't always feel completely natural at first, because nothing new feels completely natural at first, but it starts to feel natural. And, you know, even if it doesn't, I think that's okay. Your child is still hearing a really important message. And so that's the first of those two big picture elements of space treatment.
Just to give an example for people, let's say they have a child who's afraid of the dark and they want their parent to lie down next to them every night. What would the sound of a supportive statement, what would a supportive statement sound like?
A supportive statement might sound like, I get it. It's really scary for you when you're in your room by yourself, and I know you can handle that feeling.
Perfect.
Yeah, really simple. We're not looking for creative writing PhDs. We're not looking for, you know, anything very fancy. I'm just letting them know. And I'm not even saying, and so you need to go and lie in your room by yourself, right? Like sometimes, in fact, not sometimes, pretty much always, we will start using those supportive statements before we even try to reduce any of the accommodations, which is the like second focus of the treatment. And so even when you're lying with your child in the bed, in the room at night, you can say to them, right, like I am here, but you can say to them, you know, I get it. Being by yourself would be hard. It would be scary. You know, I actually think you could handle that. And your child hears it. And then only after we've practiced that for a while are we going to start turning our attention toward those accommodations. When we talk about accommodation in the context of a child's distress or their anxiety, what we're really talking about is just all of the things that you as a parent, that you do differently because your kid is anxious and you don't want them to be. Sometimes you're doing something to lower the anxiety. Sometimes you're doing it preemptively because you know it would make them anxious, and so you're taking steps to make sure they don't get anxious, right? Like maybe your child is scared of bees, to use your example, and so I plan my weekends to not have bees, or I keep all the windows in the house closed because otherwise they freak out. What if a bee comes in? And so I never do open that window. Or we don't go to the park when we're, walking the dog because what if a bee shows up? Or I search the house for bees.
Or we take a long car ride instead of a quick flight because they're scared of an airplane.
Yeah.
Or really, we only make them mac and cheese because they're afraid to eat anything else, and so we accommodate them in that way. There are so many examples that come up and come to mind.
Exactly. It really goes like fear by fear, worry by worry. You can see how parents might be accommodating, right? Like maybe my child is socially anxious, and so we don't go to the family events because other people are there, or I don't invite guests to the house, or I speak for them in social situations because they get awkward and uncomfortable and feel shy and embarrassed, etc. There is a ton of research out there on accommodation of child anxiety, and you look at like hundreds of studies, and these are from all around the world, like really all over the world, and the over-under for the betters out there on how many parents actually accommodate their child's anxiety, well, it's around 97%. Some studies have reported like literally 100% of parents of anxious kids saying, yes, I regularly accommodate. Some have gone as low as about 95%. It tends to average out at around 97, 98%. So regardless of the exact number, what it really means is that if you are the parent of an anxious child, you're probably accommodating.